Okay, so while we're still waiting for the last few panelists, we can go ahead and get started. Thank you everyone for taking your time to join us on a Saturday. We really appreciate it. We know how busy you guys all are. I guess we could kick it off with a question that I'm sure a lot of applicants this year are curious about regarding this virtual application cycle. How do you think programs are going to be able to see which students and what qualities in students set them apart from other applicants, especially those that are not known quantities to said institution through home rotations or other research opportunities?
I mean, I guess I can start it off. So for those of you who don't know me, I'm Mike Kaplan. I'm the program director at Cornell. I'd be shocked if anybody said anything other than what I'm about to say, is we have no idea, right? I mean, we're all working through this together. Having said that, I'm sure we all have our own ideas and we're all rapidly evolving what we're planning on doing. But, you know, this has been an incredibly, last minute evolving experience. I think it's going to be a huge challenge. And I think that I suspect a lot more programs are going to lean more on their own students than in past years. I'm not saying that that's a guarantee. I'm sure people are going to go in various places, but if a place has a bunch of students that are interested in neurosurgery, I think it's only human nature that they might play it safe. I think that the information in the application is obviously going to be viewed more critically this year, and we're getting less information. Right now, they're going to make the boards pass fail, and so we're going to we're doing this in an environment where we're going to have decreasing information. We're not going to have that interpersonal experience, and if this continued past this cycle, we're going to be getting less information over time. I think that what we're doing is sort of rethinking how we do it. You know, normally when we do our interviews, we have the entire faculty interview everybody, and we do it in groups of, 2 or 3. And I think a lot of neurosurgery programs do that, right? We're not like general surgery or pediatrics. We got 8 million faculty and there's some committee that interviews people. Most neurosurgery programs are small enough that at least a large subset, if not all the faculty at many programs, interview. But that's going to be a real challenge, I think, in a video format to do that properly. And so I think, we're kind of rethinking how we do it so that we can get, to your point, the most effective information out of the applicants. I'm not saying we're going to change it just yet, but we're actively thinking about that because it's really critical to us that we extract, that kind of relational information from one another. Because, as I say over and over again to students, this is 7-year residency. There's there's very few people who've done anything in their life to this point for 7 years, right? And we've got to somehow try to get a sense, not just of, are you smart enough? Because that we can do by reading, but, are you going to be the right fit? And are we the right fit for you? And so our normal way of doing this is going to be a real challenge. And we're really actively, and I can't say we have an answer yet, but, we're going to try to make the online interview process as effective as it can be. The one good thing about these endless Zoom meetings that we're all having is at least it's giving us some idea of what's working and what's not working, and we can bring that to bear. But I'll let others, opine on this, because I don't think we have great answers just yet.
I think I'll follow that up. For those of you who don't know me, I'm Dr. Wolf. I'm at Wake Forest, and I was given the opportunity, let's say, to help lead the national neurosurgery effort to figure out how we're going to do this. And so, as Dr. Kaplan said, this is absolutely an evolution, and I think one of the most important things is honestly hearing from the students and using our collective wisdom. This year will be a little bit different. We are definitely wanting to make sure that we include elements that we know how to grade, things that have been traditional, so that we have some of that as a baseline. But this is definitely a year that we need to be innovative, and it is a national strategy and a collective group effort here. One of the things that we're working on right now, and much of this stuff is hot off the presses because it literally is happening within the last 1 day or 2 days. But we're working on a Zoom meeting for all the program directors so that we can kind of come come together, share our thoughts, pool our thoughts, what's worked for us, what hasn't worked, so that we can come up with the best strategies. There are going to be many new types of opportunities. One thing that we're working on right now is giving every medical student applicant the ability to share their science. That's one thing that we all have done always. Every AI or sub-I that you go to, you go ahead and you give your talk, right? And that's not going to happen now, except to your home program or your adopted home program if you're from a school that doesn't have one. And so having the ability to have a repository on the SNS website database so that everybody can see your talk, your science. So these kind of strategies we're absolutely working towards. But it's interesting because there are a lot of students that don't have a home neurosurgery program. And in fact, this year there happened to be a lot of programs that don't have student applicants. So there are going to be some programs who have the luxury of having 2 or 3 students at their program, but that means somebody's got to match somewhere else. And so, I think that the take-home point for all of the program directors and programs for this year is going to be, we really have to work as a group. This is not going to be successful if 50 programs match, and do a great job matching the best and brightest applicants, and then we have a ton of unmatched applicants and a ton of unfilled programs. And so, one thing that is going to be really important with the program directors is that we look at each individual student. We know, kind of our different programs and the culture and such at those programs. And, already I've been doing a lot of reaching out and vice versa with program directors saying, I've got a student here, and we'll learn more and more as we start doing the sub-I rotations who, might really be a great fit, great candidate for your program, and so there'll be a lot of personal reaching out across the board, as well as the standardized interview process.
Hey, great job, Stacy. Thank you for leading the effort. So Jamie VanGaal at Mayo Clinic, I think that the applicants that are on the line here are going to have to be prepared to, have a lot of different time on Zoom meetings with all the program directors across the country. I think what you're going to see, rather than having to select between 15 and 20 visiting interviews, is you're going to have to probably interview at a lot more institutions now because you're not so travel limited. But you're going to prepare to see interviews that probably are not going to occur on one day. You might actually have to interview over the course of a month with the program, which I think is something to prepare for. As Dr. Wolf said, sharing that science, even if there's a repository that the SNS puts out, I think programs like ours are preparing to invite a lot of applicants to. Maybe we put 4 applicants together on a day and present to our department and give the opportunity for interaction with them. But I think it's going to be a lot of time doing this, and it's going to be probably a lot more effort on your all part to see us. But I do think we're going to get the personal touch. I'm not as concerned that we match 4 applicants per year at our place, and I'm not that concerned that actually I think it's going to give us in a lot of the programs a lot more ability to see the more the pool and depth. And I bet you we end up having better fits for our programs now. We do have the USMLE still this year. I don't think that's going to be the necessary threshold for this. I think it's going to be a lot of how you show, be quite honest to each person you're talking to, and take advantage of those opportunities.
Yeah, this is Nader Dadali, Northwestern. I definitely totally agree with my colleagues, fellow PDs at other programs. When we look at an applicant and and the vetting process, we don't look at 1 or 2 things. Look at about 6 or 7 things. We engage 8 faculty in reviewing the 300+ applications that are submitted online, and and the 7 things we look at, we follow the Feinberg Medical School approach, holistic approach. We don't only look at the board scores, but we factor that in. 1 out of 7 criteria. We look at performance and medical school dean's letter, recommendation letters, which is probably the most important thing that we look at, actually, the recommendation letters, and then we kind of reach out, as Dr. Wolf has alluded to, personally reach out to PDs and faculty from other programs, and we also look at emotional intelligence, resiliency, and other things that we look for during the interview. So, and during if an applicant has the opportunity to rotate with us, we'll look at that, while they're rotating with us. So losing this sub-internship opportunity is a big thing, but as Dr. VanGaal, spoken about, there are other ways that we can compensate that for, through Zoom meetings, but it's going to take a lot of effort. And I think, many applicants are talented, and we'll sort out how we're going to figure out the matching process. I think definitely applicants should keep an open mind and reach out to as many programs as they can, because they can do that now easier since there's no traveling involved. Ultimately, at the end of the day, what we will rely on, probably the most two important factors in terms of the selection process, is the letters of recommendation from the home programs. We're going to really heavily rely on that, word of mouth, and the interactions through Zoom meetings, individual interactions, so that we can gauge the personability and the characteristics of an applicant. I'm positive about this. It's a challenge, but we will overcome it. We'll end up. Each program will recruit their best fit, and it's going to be a great process. And some of these things will, applying Zoom meetings and telemedicine. This is going to probably is here to stay. It's an opportunity for some of these things that we've never used before. We probably will end up, if it's a successful experience, we'll end up using for the years to come.
I think that I completely agree with that. And if you'll indulge me in giving me a moment to talk about some of the new things that we are working on, because I completely agree with Nader. This is something that is going, you guys should be excited. You're the first class of something that will likely stay in perpetuity. We are very hopeful that, of course, in the future, we will bring back rotating sub-Is or externships. There'll certainly be a lot more visiting across the board that ends up happening. But I do think that there will be a real element of virtual recruitment that does stay with us. And so, it's up to us to develop something that really works. And so I would encourage all of you, share your good ideas with us. This obviously affects you significantly as well as it affects the programs. And we don't want it to be a whole bunch of programs figuring this out together and figuring out something that is missing an important element from the medical student realm. With regard to the letters of recommendation, in the past, these are something that we very heavily rely on, as we will in the future. But there has not been standardization. And that's one thing that the NRMP has come and said, some degree of standardization will be important. There have been some programs that have been very successful, or I should say subspecialties. Plastic surgery has had a very successful standardized letter of recommendation. The emergency medicine has. General surgeries has been so-so. And so this is something that we are really working on, and it's currently circulating amongst all the programs. It will be something, that we get out to the students also to look at, and having that happen in the near future, because we know that y'all are having your rotations coming right up. But to get some standardized and granular data, all the things that you've heard all of these program directors talk about, it's not just about how smart you are, but it's the whole package deal. And so really being able to get that information. And these they'll be on the website. And so these same letters can be filled out, in Canada, internationally, and we'll get similar types of data across the board. One thing that has been a point of interest, a little bit of contention and such, has been a general surgery letter of recommendation. And that is something that we are asking for. Obviously, everybody's going to be rotating at one neurosurgery place. And so having 3 or 4 letters from the same department is perhaps less helpful than getting a bit of a better breadth of experience from what you've done in similar types of rotations. General surgery, obviously, it does not exactly mimic neurosurgery, but there are a whole lot of elements that cross over and are similar. And so, one of the things is we all have a core surgery rotation. And so a lot of this letter, it will be the granular grades from your core surgery rotation that don't always come across in the dean's letter. But in addition to that, of course, we want to make sure that this is personalized, to a great extent. And so, a lot of schools have gone to 4-week or 3-week even rotations, and our ARIS deadline has been backed up to October 16th. And so that really gives everybody, a good bit of time. We don't want everybody doing, and it's not possible to do 4 or 5 rotations in neurosurgery at your home program. And so most schools cap off at 2, and then you can do some neuroendovascular, neuro ICU, some kind of a related specialty, but do make sure that you spend time in surgical subspecialties, do some vascular, do some plastics, do other types of things, and those people can help to write your letters. It's good to have mentors in every aspect of what we do, in surgery. And so that's one of the questions that we've gotten quite a bit. And hopefully that sheds some light. And again, if there's confusion or ideas, please send them to us.
And just to kind of back up a little bit for Dr. Wolf, is the SNS has asked that the medical students rotate 8 weeks at their home institution. And those that don't have home institutions are supposed to be their closest available institution. Now, unfortunately, I think that's a little short-sighted, and I'd be curious to know what people think out there about, some people are well away from home and want to match closer to home. I wish they were able to rotate as an additional option at the closest available to their hometown. And unfortunately, it doesn't really give a lot of information as to those IMGs. I see there's a lot of questions from IMGs on the side here. If you're not at an institution currently enrolled, I don't know, the SNS doesn't say, so you're going to have to go around to each individual institution and find out if they're allowing graduates to rotate at their institutions. For instance, Mayo Clinic is, and that's a GME directive, but not everybody may be doing that in an effort to conserve protective equipment.
And I would follow that up to say, the main reason that the SNS came up with these policies is because a great majority of institutions are not allowing people to rotate, either anybody to rotate or anybody outside of their state to rotate. Sometimes you'll get a special dispensation if you have a school that's actually closest to you but in a different state. But this is difficult this year with this particular topic. And so, definitely for those, if you've rotated previously with a group, absolutely that is something that's very understandable. Get a letter from somebody that you've rotated with previously. We don't want to see people scrambling to try to get a new rotation or a research rotation or something like that, and kind of getting around the rules. There are some institutions that are allowing rotating students, but again, the vast majority are not. And this is very easy for me to say because I'm not applying this year, but this really does have to be a group effort and working with equity, and not having 1 or 2 or 3 people that are standing out because they've gotten all of the opportunities and somebody else has gotten no opportunities, and so it's balancing equity with balancing each individual and the great things that you have done. And there will be, the good news is with the virtual abilities, there is absolutely the ability to reach out to individual programs and just say, hey, here's my situation. I'm interested in your program. And that of course is a very reasonable thing to do. Some difficult situations, but again, let me know. This has been really helpful because we have been able to fine tune and help the policies as people present their difficult situations. And usually you're not the only one in such a situation. And then we can amend the policy for the greater good.
Yeah, so a big part of the application cycle in the past has been for interviewees to actually come and assess things like culture and fit. And a big part of the application and the interview day is the night before the resident dinner. As program directors, how do you recommend applicants assess things like culture of an institution through a virtual platform?
I mean, I think, look, every program is going to be different to some degree. I think most programs are going to arrange something for applicants, at least for applicants that they're interviewing or whatever, with the residents so that they can have a session. I mean, everybody's been doing these virtual things with their residents anyway throughout all of this, virtual happy hours, virtual whatever. And so we've kind of already gotten into a culture of being able to socialize virtually. We had our virtual graduation last night. I think you could get a pretty good sense if you came in from the outside, from Mars, and watched our virtual graduation last night. You got a pretty good sense of our residency, our residents' interactions, our faculty interactions with them, et cetera. And so I think we can all do it. It's going to require some creativity. I also think that for the applicant, the way the program goes about doing these things itself will tell them something about that program, what their approach is to things, and we are going to, I agree that we're all going to try to standardize things as much as possible in some areas, both for equity and to make sure, as you heard earlier, that we don't have all these disparities in matching, et cetera. But each program is still going to have their own individual character, and I think the way they approach it will say a lot. But I think we're all going to try very hard to not just have a series of sterile, Zoom calls with faculty and that's the end of it. And if a program does that, they're being pretty stupid, frankly.
I think that this is going to be the opportunity for the applicants on here we'll probably rely on our residents a lot more now, because finding out whom amongst you is reaching out to our residents to find out about the culture. So, if you're interested in a program, you should be reaching out to the residents and staff and spending the time to get to know them. That's going to conversely raise it's going to elevate your profile in that program. And I'd encourage you to do that, because we all realize that you guys can't do that to 100 programs across the country. So if we see engagement from your side, so it can't be just a one-way street here, I think that I would really encourage you guys to start now looking at on the websites. We all have them now with our resident profiles, resident bios. Reach out to them, reach out to staff, get to learn the programs now, especially before you invest time in trying to interview at some of these programs.
I mean, I agree with my colleagues. I mean, it's gathering information about programs. It goes both ways. Also, applicants should kind of make an effort to reach out to residents and do their homework in terms of, asking about the program, having, people who have rotated before, what's their experience, rotated and didn't stay at at our program, what their experience was, what our strengths are and weaknesses, and it's about the best match.
The only thing I would caution the applicants about is one of the potential pitfalls of the way we're going to be doing this year is that because everything is so virtual, it makes it easy to do things more widely than you've done before with less effort. And I would caution against that because, we want, as you've heard from everybody, we want you to be proactive. We want you to be reaching out. But it's a small community, right? If you send the same form email to like 100 programs and to 15 faculty within those programs, we're going to know it in about 4.5 seconds, right? So I think that what we want are people who are genuinely interested in our programs, who've actually spent a second. And so if you don't spend a little effort to know something before you reach out, it's going to come across. But if you do put in that little bit of effort, this represents a real opportunity, as you've heard, to even before the interview process starts, distinguish yourself a bit. But the volume is going to be so high. I mean, as you've heard, if we are each looking at 300 applications, we can't do like a virtual interview process where we answer questions for 300 people, across the board over and over again. So be, selective and make sure that what you're doing makes sense to a large enough swath of programs, but, 20, 25 programs, not 100 programs.
Yeah, I'm glad Dr. Kaplan clarified what I said, because the dirty little secret about matches before the COVID-19 and all this virtual stuff was that oftentimes if I got a call from Don Quest from Columbia, I would take that applicant a lot more seriously, and having someone personally invested in calling for you is important. But I also agree with Dr. Kaplan that we don't want to see, the matching bots put a bunch of form emails into every one of us and I think that's going to be sniffed out quite quickly. It's going to be real relationship development and real sincere interest in programs. And I think that's very easy to pick up for most people.
Absolutely.
And I think one thing that's important, obviously we're spending a lot of time right now talking about the application process because there are changes with it, right? But I think if we get down to the nuts and bolts of this is neurosurgery. Why do we do neurosurgery? What's important in neurosurgery? And so, with the application changes, there are changes. They're in evolution right now. So everything that we tell you right now, there may be some changes there. Fair warning, every program is now updating their website, and every program at every institution is currently updating their website. There are going to be lags with that. And so, there are going to be, if you look today, the websites are not going to look the same that they do in a month, so make sure that you're checking back, that you understand that this is all an evolution. But what you can stick to is the basic tenets of why do we do sub-internships? Why? And I think the big importance is we want you to know what you're getting into. We want to make sure that this is going to be a specialty that you're going to love for the next 20, 30, 40 years of your life, that you want to do. You want to take care of these particular kinds of patients, that there's not something better out there for you. Which of course I'm biased. I can't imagine there's anything better than neurosurgery, but you need to know that before you actually sign on the dotted line to a 7-year residency and then an entire career. And how do you figure that out? You take care of the patients, you get invested, you make sure that you're there at 2 o'clock in the morning and at 6 o'clock in the morning and at 2 o'clock in the afternoon. You make sure that you like these kinds of surgeries, scrub in, see if you have the aptitude for it. Can you close? Can you open? Is this something that you love? And part of that is developing mentorship with both residents and with faculty, and it's not that superficial look at oh, hey, this looks like something that's cool. It's finding out, the unpleasant stuff, the everyday stuff. Is this still something that you're going to love? That's why we have you doing 8 weeks of a rotation, so that you can really get to know what it is that we do, and don't stop it there. Figure out what people do when they're at work and what they do, as after work, and all of this kind of thing.
I think one of the experiences Dr. Wolf was pointing out that's important for the persons that are kind of on the fence and learning about neurosurgery, and I see this in some of our residents sometimes, where it's tough to handle some of the bad outcomes that happens, especially with trauma patients, and whether you're personally invested. So you don't need to be in a neurosurgical rotation to understand how hard you take patients doing poorly, because that's real, and some people can't work through that and keep a positive attitude in life. So I think you need to seek out still in your own medical school experiences some of the difficult things that neurosurgeons deal with, and understand if you're the right person for that, if that's not going to make an emotional pull on you later on in life. And so I would ensure you still do that at your own schools.
What is everyone's perspective on virtual sub-internships?
I'm in favor. Yeah, go ahead.
I'm just saying they're in evolution, but go ahead, Nader. I'm sorry.
Yeah, no problem. I agree. I mean, I'm in favor. We're gonna, put something together here at Northwestern. I don't know what to call it, virtual sub-internship or something else, but the hold up here with the COVID-19, as I'm looking at it, like we look at 7 things, and the only thing that's gonna change is the recommendation. Like sub-I, there are no sub-Is, fine, but you can rotate at your home program or at another program, and then this would translate into recommendation letters coming from one source, right? So we will definitely reach out and read the recommendation letter, and then reach out beyond that to kind of ask questions if we have to, because usually what we do, we look at recommendation letters from outside of the home program, because the home program is in favor of their home students. So we always look at those recommendation letters and recommendation letters from sub-internships elsewhere. That's not going to happen. So that's the only change. Other things, scores, dean's letter, personal statement, research experience, non-research experience, that's going to be there in the application. And then, and that based on these information will offer a candidate an interview. Now, beyond that, the interview process will be definitely virtual. Now, if someone is torn between applying this year versus next year, if they want to take a year off, get a degree like a Master's of Science Clinical Investigation or MBA or something. I have some mentees who are like not sure. Told them, you can, this, if you're not sure, take a year off, think about it, and get a degree out of it. Do some more research, get to know the field more. So if there are things that we can't predict because of the COVID-19, and you're still uncertain, so that's maybe an opportunity to think about it more and take a year off or something like that. I mean, I'm not saying that universal rule, but we want people who are passionate, who want to do this no matter what, and then you follow your dreams, you'll achieve them.
Yeah, I think to follow up on that, the one thing I would add is that, obviously these changes have created a lot of anxiety, but fundamentally, right, this is still about you, who you are, and of course us. And that represents more than just a 1 month external sub-I, right? I mean, I know we're all kind of worked up about it, but the fact is that, you're the sum total of your life and even your medical experience is more than just missing that 1 or 2 extra sub-Is. They're important. I'm not trivializing it for all the reasons you've heard from everybody. It gives us an idea of what different neurosurgeons think of you, and it gives some element of consistency in a small specialty that, it involves so many years of your life, et cetera. I get it. But the fundamentals are still the same, right? You still have an application that's going to look at what you've done over the last 3 years or 4 years or 8 years, however long it's taken you, right? And a lot of that is still going to be the same kind of stuff that we're looking for, particularly, I mean, it's not like we would interview people before we would accept them for interviews. We would look at their application. So the main thing that we'll be missing are these sub-I letters. Okay, fine, we'll deal with that. But that's really more of a ratification than a fundamental sort of yes, no. I mean, I assume, because I'm seeing a lot of nods from the other program directors, but the way most of us look at it is we look at what you've done, and then the sub-I letters kind of just confirm if we were kind of leaning one way or the other to begin with. But it doesn't it's not like we look at that first to say, should we or should we not be interested in you? We're looking at what you did to be interested in you, and that still hasn't changed. So the point about taking a year off, I wouldn't try to game the system, because I don't think that ever works, by saying, I've got a good application this year, but maybe next year will be better because I could do an external sub-I. I don't know that next year is going to be better. We don't know what next year is going to be, right? But on the other hand, if your application was a little marginal and you were hoping that you really are great once you get in the room, and if you can get into the room in a few places, you'll do great or whatever, but your application, you didn't really have enough stuff there for the top neurosurgery applicant, and another year could make that difference, right? So an extra year is not going to change the fact if you did lousy in your clinical grades. But let's say you did great in school, but you don't quite have the level of research of some others or whatever, and maybe you think that might hurt you a little more this year and you've been on the fence. Yeah, then maybe that extra year of doing something interesting. Ultimately, we want interesting people. We don't want a bunch of robots in our program, right? And that's where all of this stuff matters, I think. And we can get a lot of that without the sub-I letter, and we can get a lot of that through the virtual interviews, but it's all about what you've done. So look at yourself very critically and say, have I led an interesting life? Have I shown that I can accomplish things? Do I have things that I can bring to the program? If you do, apply this year and don't worry about it. We'll all figure it out.
Totally agree. Yeah, go ahead, Steve.
No, I think that's great advice. I think that we want to see this application cycle be very similar to all other application cycles. Yes, there are some differences, but definitely don't go away from this thinking, oh, I should take a year off. I should do something wildly different, because I don't think any of us believe that. And I saw a question come by with, well, how do you show through your letters that you've got what it takes and such. This really, again, comes back to developing that mentor-mentee relationship, and do a great job on your rotation, and that will get filtered down. If you're not sure what your application is shaping up to be, talk to your mentor, find somebody or several people from your program and talk to them about it, get their input, and they're going to be also the ones that are helping to promote you and to sponsor you, as they reach out to other programs and say, hey, I've got this person and they are really great. And so you just have to show that. But it is absolutely, I agree with Dr. Kaplan, it is the sum of your work. Going back just briefly to the virtual experiences, I also am all for that. I think, even something like this, it's really important to get information and education. I'm very opposed to them from a marketing ploy standpoint. So, you know, if you see something that really is just to show off, you know, some programs, bells and whistles, I don't know that that's all that helpful. But if this is going to be something where you get some information that you can take care of a patient better because you know X, Y, or Z, absolutely something to do. It is not something that you should get a letter from, right? The letters are specifically geared so that we can say, from a hands-on perspective, this person is excellent or marginal, you know, and so that is not where your letter of recommendation should come from. But it's, you know, get information, be educated. They're wonderful. I mean, this is a whole new platform that we've just really never used before.
Casey, can you clarify? Because I came away from the SNS with the understanding that 3 letters were from the home institution that you did your 8-week rotation and 1 from general surgery. You just said that you can't get 1 from a virtual, or you said you would recommend against doing it. You cannot get 1, right? I mean, are we going to standardize that? Because that was my understanding coming away from the SNS, that even if someone spent additional time elsewhere, they should not submit a letter from elsewhere, or is there language that they're going to be able to follow for that?
Yes. So with the letters, basically the rules, if you will, the policy is 1 general surgery letter, which is going to come. It needs to be linked in some form or fashion to your core surgery rotation, which you did at your home institution. The one exception to that is somebody who perhaps didn't match the year before and they're now doing a general surgery internship. That could come from, you know, from that, although we also want to, there needs to be some nod to, again, what the grades were in the core externship. Then 2 letters of recommendation have to be from neurosurgery faculty at your home or adopted home program. And then there is, you know, and obviously ARIS allows you to have 4 letters total. And so if you are somebody who's had a research experience at your home institution, fantastic. If you had a research experience that was done prior to April, right, prior to COVID, that was done at another, you know, an outside area, absolutely. That's something, again, that's your body of work. That's what you've accomplished in your life. You should definitely share or include that. If you've had a clinical experience, there are, you know, it's not the norm, but there are some people that went, you know, and did some research and did some clinical. Again, if it is prior to COVID, that would be fine, you know, and I've had some people ask, well, you know, I had 2 mentors, 1 research, 1 clinical, you know, when I was working at this other institution. Go ahead, have them combine their letter. That's perfectly acceptable as well. You know, but you need to have at least 2 letters, clinical letters from your clinical mentors at your home or adopted home program, 1 general surgery letter. And then for most people, it will be a 3rd home neurosurgery letter. But again, it could be research or other.
And Stacy, just to sorry to put you on the spot, but I know you're working on this with the SNS, and I think it's important. How are they, so if 1 person were to get 4 letters across different institutions, how would the SNS tell us to manage that as program directors?
Right. So that is, we have already asked, that is unfavorable. You know, if we see somebody who comes and they have 4 different letters from 4 different programs, that is something that, as you know, nationally, we have agreed as program directors that is something we will look unfavorably for. So that is not a good way to game the system. It is going to backfire.
You know, looking at this chat, I just want to address something because I'm probably, you know, at fault for this, you know, starting this, but there seems to be a lot of anxiety about the board exam. And there's a million questions about how we're handling the board exam and with the changes in CS and whatever. You know, I just want to give, I mean, this is just my opinion and I'd be curious to hear everybody else's, but you know, we've never been a program that screens out applications based on certain minimums. I know some do. We've never done that. We literally look at, well, I look at every application and then you know, we have a committee that kind of winnows it down to some degree and then we kind of, you know, get to a certain point. But you know, at least I lay eyes on every aspect of every application, which is painful. But of course, the board exam has mattered. To me personally, I could care less about 1 day of a standardized exam compared to your whole life. But it does say to me, you know, I just don't want somebody who's going to have a problem with the boards when they're in our program. It doesn't really say to me much about your abilities as a human being. I just want to make sure you're not going to have an issue. So if someone had a bad board score, and let's say they had, you know, they didn't do great on a couple of shelf exams in their, rotations, so that they had great clinical scores, but they had, a high pass instead of honors or something because of their shelf exams. It says maybe there's an issue with exams, and do I want to deal with that, right? But that's really for us, that's the way we look at it. We don't look at it as really like a major gating factor in our program. So all these issues of, will step 3 count now more because of this, or will step 1 or 2 or whatever, or these different subsections, who's going to count more? Again, the pass-fail thing, I was making a general point. It's not happening this year. I was just saying that we're going to be getting decreasing information over time, so we're going to have to evolve processes, I think, that really use less sort of screening type info from one score and more personal info than we've even done in the past. That was the only point I was making. It's not that it's not going to count this year.
Yeah, same thing here. Holistic review of an application. Board exams may be one of the least important criteria actually here. We look at an application, we look at everything, not on how you performed one day. So it's like if there's no correlation between a mediocre performance on the board exam and then you're doing well on your shelf exams and med school examinations, so that will cover for it totally. And good news too, sub-Is like. We have sub-Is who've rotated. We didn't invite them back for an interview. It doesn't mean that if you rotate, you'll get an interview. We've matched a lot of people in our program who didn't do a sub-I at our program. They did not do a sub-I. They did not choose us for their sub-I rotation. And then, they matched here, and we usually match our really top applicants. So that's all good news. So it's not like if you didn't do a sub-I at the program, you don't have a chance to match there.
And I'll just deflate the USMLE bubble further in that, even I know that Nader said, we all see about over 300 applications a year. And even if you use a threshold and, 230, let's say, you're only getting rid of 75 of the applicants by doing that. And I'll say even further, about 2 years ago, there was a gentleman that matched, I won't say where, but was highly sought after with a score of 210. And had some very special things about them. There's also a lot of literature in the education literature about how super high board scores are actually counterproductive for physicians being good with people later on. So there's a lot of into this, but I don't think anybody's really using the USMLE scores like the applicants think they are, and it's kind of a bear trap anyway.
Somebody asked an interesting question in the chat about what if, because of COVID-19, some institutions switch some of the core clerkship grades to pass-fail, how that would affect things. I mean, obviously, the less information that we have, the harder our job is to some degree. But again, I don't think, we all know that this is a tough year. So we're all, as you can hear from this discussion, we're all prepared to put in a lot more effort into this process than we have in past years. Hopefully that level of effort won't be necessary every year, but we know that this year it's going to be necessary. And so I think, if your institution, let's say, only did pass-fail, and there are medical schools that do pass-fail for the whole thing, and those students get into programs, I think the problem's going to come is if, you have some grades that aren't pass-fail and some that are because your institution decided that only during the COVID part will they switch to pass-fail. If they actually did that, because that's what the chat implies, I don't know of any school that's actually doing that, but if they did do that, where it was confusing to us because we see some honors and then we see just something that was converted or something, you should talk to your institution if they're really planning on doing that and make clear to them that they've got to make that clear in their letters that, in the letter that accompanies us, because some institutions, frankly, are a lot better in their legend of what their grades mean than others, where it can be incredibly opaque. And if you're concerned about it at all, then as you've heard from everybody else, reach out or make that clear in your application or something if they're doing something silly like that. I think that if it's clear, if they say we're converting all of our clinical clerkships to pass-fail for that year, well, there are schools that already do that. So, and those students get in, no big deal.
I want to thank, on behalf of all the participants and the organizers of the event, I want to thank the program directors again for joining us. This has been a very insightful and honest talk about what this application cycle is going to look like. And I think has been really helpful for some of the MS4s about to enter this unknown entity. So thanks again.
Hey everyone, Ryan Rad here from neurosurgerytraining.org. If you like that video, subscribe and donate to keep our content available for medical students across the world.